Many people who suffer a heart attack and had normal reports just days or weeks before it happened. Normal ECG, normal echo, sometimes even normal blood test. So today I want to explain very clearly why heart attacks happen suddenly without warning and what this means for you and your family. This video may save your life. Heart attack is one of the leading causes of sudden cardiac death worldwide. What is most frightening is not just a disease, but the false sense of safety people get from normal reports. I see this in clinical practice regularly. Patients tell me, Doctor, my ECG was normal, my echo was fine, my cholesterol was not high, and yet they still suffered a heart attack. So let us understand this step by step without fear. First, let us understand what really causes a heart attack. Heart attack does not usually happen because a small artery closes completely. In most cases, it happens because a small unstable plaque suddenly ruptures. Think of it like this. Inside your heart artery, fat builds up quietly over years. Some plaques may be hard and stable, and others are soft, inflamed, and dangerous. These dangerous plaques may not cause severe blockage. So, ECG can be normal, echo can be normal. So, you may have no chest pain also. But when the soft plaque ruptures suddenly, a blood clot forms instantly and blood flow stops suddenly. This is a heart attack. So, the danger is not always the size of the blockage, but the nature of the plaque. Why reports can be normal? Let us talk about the reports. An ECG at rest shows electrical activity, not artery health. An echo shows heart pumping, not plaque stability. These tests are not important, but they do not guarantee protection from heart attack. This is why you can walk, you can work, you can sleep normally, but still develop a sudden heart attack. This is not to scare you. This is to make you aware. Now I want to speak briefly what pathologically happens. Clinically, we know the plaque's vulnerable matters more than luminal narrowing. Thin cap fibroathyroma, inflammatory plaques, and endothelial dysfunction are often silent. Resting ECG has low sensitivity for ischemia. Echo detects consequences, not causes. This is why risk stratification, family history, smoking, diabetes, stress, inflammation are more important than isolated test results. A patient with moderate risk factors and normal reports is not risk free. This is a crucial message we must reinforce. What should patients do? Very important. So, what you should do? First, do not ignore symptoms like sudden fatigue, breathlessness, sweating, upper back or jaws discomfort. Secondly, do not rely on only report test what you have got it done. Risk assessment is more important than reports. Third, control what you can control. Blood pressure you can control. Blood sugar is in your hand, you can control. Cholesterol is in your hand, you can control. Smoking is in your mouth, you can control. Sleep in your mental mind, you can treat, and stress. And finally, any symptoms are sudden or unusual, seek medical help immediately. Time saves heart muscles. Delay kills. As a cardiologist, I want you to understand one thing clearly. Heart attacks do not always give warnings, but knowledge gives you an advantage. Understanding risk, recognizing early signs, and acting quickly can save lives. If you want simple, honest, doctor-led explanation about heart disease, subscribe to this channel. Every week, we will talk about heart health clearly, calmly, and scientifically. Thank you for watching.